One would be mistaken for thinking today was just a normal day here at Derriford Hospital, but up the road was a different story as the nurse strike went underway. With many wanting to tell us why they felt so passionate about the strikes.
Here today to support all the nurses on the ward. I think it's really important to recognise patient safety, and at the moment we aren't able to keep our patients safe because there's just not enough staff. So it's not all about money, it's not all about the pay rise, it's all about, for me, keeping our patients safe and me being able to do my job as a nurse, because I don't feel that actually I'm able to give my full time as a nurse, how a nurse that I think I should be. And I just think, that's why I'm here, just to support all of that.
I haven't come to a discussion point with the unions. They're the reason that we're here. No nurse wants to strike. This was an absolute last resort. Secondly, pay is absolutely integral to recruitment, retention, and for nurses to feel recognised and valued for the amazing work that they do. And 12 years of pay awards that have been below the cost of inflation has had a real significant impact on us being able to keep our nurses and train them.
Been an NHS nurse for 37 years. I've recently retired only last month, and I got the ballot papers to ask whether I wanted to strike or no, and I feel very strongly, and of course I said yes, I would strike. That's why I'm on the picket line here today outside Derriford Hospital, and as you can see we've got a really good turnout of people, lots of support, cars, buses, people all honking as they go past. There's one already. I did feel really strongly because in the country at the moment there are 44,000 nurse vacancies at the moment, maybe more than that, and I do believe that in a couple of years' time it's going to be well over 70,000. So we really need to make nursing a career appealing, pay more for the nurses so we get more nurses on the wards, and staff shortages cost lives, so we need more nurses to come and join us.
The main reason for the strike is the lack of a decent pay rise, with the strike demanding a 19% pay rise. But the Health Secretary, Steve Barclay, has said the demand is unreasonable as it would lead to turbocharging inflation. One of the nurses, Jane Gilliam, who we had just spoken to and had been working for the NHS for over 3.5 decades, had this to say.
I think that 19% is a lot, but we do a very demanding, responsible job, and we should be paid a fair wage for it. I think they're saying at the moment, save nurses, more money in our purses, save the NHS, and that's what they're shouting out there at the moment.
The Health Secretary still refuses to budge as he made this response to the demands.
So last year recognised the contribution of nurses. That's why nurses received 3% more than most other public sector workers last year as well. And they themselves say there's a range of factors in addition to pay, and of course we'll be discussing that with them. But we also need to recognise that these are economically challenging times. We need a strong economy in order to pay for a strong healthcare system, and a demand of 17%, 3 times what most non-public sector workers will receive, is out of step with the economic circumstances that we face.